Hello, everyone. Welcome to this presentation entitled Empowering Young Women Through Breast Cancer Awareness. My name is Rodora Lego, and I am a graduate student at Aspen University pursuing Masters of Science in Nursing with a specialization in public health. This presentation is part of a practicum project I'm working on that focuses on promoting women's health and disease prevention. I'll be sharing important information about breast cancer awareness, specifically for women between the ages of 20 and 39, to emphasize early detection, encourage proactive behaviors, and promote regular screenings. When we hear the words breast cancer, many of us think it only affects older women. But the truth is, breast health awareness is important at every age. Today, I want to talk about why younger women should care about breast cancer awareness and how simple knowledge can make a real difference. This presentation aims to educate younger women to increase knowledge and awareness about breast cancer. In this presentation, I will explain about breast cancer and how it develops, discuss the common signs and symptoms of breast cancer, discuss the factors that increase chances of getting breast cancer, describe breast self-awareness and ways to examine the breast, discuss ways to encourage a healthy lifestyle, discuss the importance of early detection and recommended screenings, explain why awareness matters for this age group, identify the myths and facts about breast cancer, and sharing survivor stories to raise awareness. On this slide, you will see parts of the female breast. The majority of people are born with two breasts, the left and the right. And there's also an external part and an internal part. On the external part is the nipples. The nipples is the rounded bump at the center of the areola. The areola is the dark skin around the nipples. Let's go to the internal parts. Lobules. These are grape-like clusters that produces milk. Milk ducts. Tiny tubes that transport the milk. Fatty tissue gives shape and volume to the breast. Connective tissues holds the breast in place. Lymph nodes are small bean-shaped organs which is part of the immune system and plays an important role in fighting infections. And the blood vessels are the ones that carry oxygen and nutrients to the breast tissues. To give you an overview of breast cancer, let me present to you the what, where, when, why, and how of breast cancer. What is breast cancer? Breast cancer can affect one or both breasts. The majority of breast cancer cases occur in women. But men can also be affected because just like women, they also have breast tissues which makes them susceptible to breast cancer. Breast cancer occurs when abnormal breast cells grow out of control and form tumors. Where does breast cancer occur? Breast cancers can start in different parts of the breast. It can start in the milk ducts, lobules, fatty tissues, nipples, blood, and lymph vessels. When does breast cancer occur? Breast cancer is most common among middle-aged and older women, but it can occur at any age. Why does breast cancer occur? There are specific characteristics and behaviors that increases a person's likelihood of developing breast cancer, and these are called risk factors. How does it develop and how does it spread? When a cell's DNA is damaged, the cell can multiply rapidly and form abnormal cells. Cells growing aggressively can form tumors that do not function properly. As a result of these abnormal cells, breast cancer can develop, and spread to other parts of the body. Facts and figures on breast cancer. The information below is an overview of the latest breast cancer statistics for 2025 in the United States, according to the National Breast Cancer Foundation. It is important to have a thorough understanding of the facts and statistics about breast cancer in the United States because it can empower a person to make better health decisions. Types of breast cancer. Ductal carcinoma in situ. This is non-invasive and considered stage 0. The cancer cells are contained in the milk duct. Invasive ductal carcinoma is the most common type of breast cancer. The cancer cells from the milk ducts have spread outside. Invasive lobular carcinoma. This is the second most common type of breast cancer. The cancer cells from the lobules have spread outside. Triple negative breast cancer. Rare, fast growing, and aggressive. Inflammatory breast cancer. Rare, aggressive, and fast growing. It affects the skin of the breasts and may cause rashes. Metastatic breast cancer. This is considered stage 4. The cancer has spread to the bones, lungs, liver, and brain. Factors that increase the risk of breast cancer. There are many risk factors for breast cancer. A risk factor is anything that increases the likelihood of developing a disease. The presence of a risk factor does not necessarily mean that you will develop breast cancer. It does not necessarily mean that you will get breast cancer when you have one or more of these risk factors. There are also people who are diagnosed with breast cancer without having any of these risk factors. Some risk factors for breast cancer are things you cannot change, and they are called non-modifiable risk factors. These are being female, getting older, family history, usually a first degree, mother, sister, or a daughter, inherited genetic mutations, personal history of breast cancer, white women, those who started menstruation before the age 12, those who have late menopause after age 55, those who had their first child at an older age, those who have never given birth, those who have dense breast, those who have history of radiation therapy, those with benign breast conditions. The other group of risk factors that can be changed is called modifiable risk factors. And these are lack of exercise, poor diet, being overweight, alcohol consumption, and those who's taking hormone therapy. The National Breast Cancer Foundation reports that 60 to 70% of breast cancer patients do not have any of these risk factors, and 30 to 40% of those who have these risk factors will not develop the disease. Signs and symptoms of breast cancer. Signs and symptoms of breast cancer may include a lump or other changes in your breast. It is important to remember that a healthcare professional should investigate all lumps, but not all lumps are cancerous. Screening for breast cancer is essential because early breast cancer often has no symptoms. So if you notice anything abnormal or anything out of the ordinary, you should always consult your doctor. Some of the symptoms are lump in the breast or underarm, thick or firm area near the breast or underarm, change in your breast size and shape, dimpling of the breast swelling, breast or nipple pain, nipple retraction or inversion, and itching or tingling of the nipple or areola. What is breast self awareness? Breast self awareness is getting to know your breast, knowing how your breasts normally look and feel, the ability to recognize changes or abnormalities. It helps in early detection. It is the visual and physical examination of the breast, and it is recommended that women perform a breast self exam several days after their period ends. And for postmenopausal women, a breast self exam should be performed on the same day each month. How does a normal breast feel? A normal breast on a self exam can feel different from person to person, but in general, it can be soft, spongy, lumpy, bumpy, or even ropey due to the glandular and fatty tissues. It changes with your menstrual cycle because of changes in your hormones. You can expect the breast to be tender, sore, and more lumpy during your period. Knowing your normal is the key to discovering any abnormal changes in your breast. This is why breast self awareness is very important. There are three ways to self examine the breast: in front of a mirror, in the shower, and lying down. In front of a mirror, put your arms at your side, sit or stand braless in front of a mirror, visually check breast for any changes, then put your hands firmly on your hips and inspect your breast. In the shower, use the pads of your three middle fingers. Check the entire breast and armpit area using a circular or up and down motion, pressing down with light, medium, and firm pressure, checking both breasts for lumps or any other changes. Lying down, put a pillow under the right shoulder, right arm above the head. Use the pads of three middle fingers. Move the left hand around the entire breast and armpit area to feel for lumps or any changes using circular or up and down motion. Repeat steps on the left breast. If you notice any suspicious lump, any abnormal changes or symptoms in your breast, make an appointment with your doctor to report them. Your healthcare professional may suggest more tests and procedures to investigate breast changes. Risk reduction and prevention. There are some precautions you can take to reduce your breast cancer risk. The American Cancer Society recommends staying at a healthy weight throughout your life and avoiding excess weight gain. This is done by balancing your food intake with physical activity. Limiting alcohol intake can also lower your risk. Additionally, breastfeeding has been shown to slightly reduce the risk of breast cancer, particularly in premenopausal women. In cases where you are at higher risk of breast cancer, such as those with a family history of breast cancer or a known inherited gene mutation that increases breast cancer risk, there are certain things you can consider to reduce your risk. It is essential to discuss your personal risk factors with a healthcare provider who may recommend genetic counseling, genetic testing, risk reducing medications, prophylactic surgery, and close observation. Early detection and screening. Screenings are tests and exams used to detect diseases in people without symptoms. Breast cancer screenings are designed to detect cancer early before symptoms appear. Early detection refers to finding and diagnosing a disease before symptoms appear. The American Cancer Society has screening guidelines for women at average risk of breast cancer and those at high risk for breast cancer. Average risk means women with no personal or family history of breast cancer, no genetic mutation, no history of chest radiation therapy. American Cancer Society recommends screening mammogram for women aged 40 to 44 as optional, women 45 to 54 to be done every year, and women 55 and older every other year or may continue yearly. Clinical breast exam and breast self exams are now optional and not recommended by the American Cancer Society as a routine breast cancer screening, but this does not mean that they should not be performed. It is crucial that women should be familiar with how their breasts normally look and feel and should report any changes to our healthcare provider. High risk are those who have a genetic mutation, first degree relative with cancer, and previous chest radiation therapy. It is recommended that women aged 30 or older who have high risk factors for breast cancer get a breast MRI and a mammogram every year. If an MRI is used, it should be in addition to a screening mammogram. A breast ultrasound is also helpful in determining if the lump is benign or cancerous. They also use breast ultrasound if suspicious area is detected on screening mammograms. And also, it is an additional screening with a mammogram for dense breast. Breast cancer in young women. Why it matters. Breast cancer in young women is also known as early onset breast cancer and occurs between the ages of 18 and 45. Most early onset breast cancers are caused by genetic mutations. Breast cancer diagnosed in young people may be more advanced since routine breast cancer screenings do not usually begin until the age of 40. Cancer in this age group might already be advanced by the time it is discovered. Additionally, young women are possibly unable to recognize breast cancer symptoms and seek medical attention. This is why younger women must have breast self awareness to identify and report changes in their breast. Studies show breast cancer in this age group is more aggressive and more challenging. Your family's medical history heavily influences breast cancer in young women. Your healthcare provider may suggest a genetic testing if you have a family history of breast cancer. By testing your blood, your provider can determine whether you have a mutation that increases your risk of cancer. Screening mammograms are not recommended for women under 40. In some cases, your healthcare provider may recommend an early screening if you have a known genetic mutation or family members who have had breast cancer when they were younger. Myths and facts on breast cancer. Using deodorants can cause breast cancer. According to the American Cancer Society, there is no scientific evidence to support this claim. Wearing underwire bras can cause breast cancer. There is no scientific evidence that bra can cause cancer, regardless of their type. Having a breast lump means you have cancer. According to the National Breast Cancer Foundation, majority of breast lumps are not cancerous. Breast cancer is common in women with large breasts. A large breast is not a risk factor for breast cancer. Celebrities diagnosed with breast cancer at a young age. Christina Applegate, diagnosed at 36 years old and is now an advocate for MRI and genetic testing. Kylie Minogue, diagnosed at 36 years old and is now an advocate for cancer screening and support. Angelina Jolie, tested positive for genetic mutation and is diagnosed high risk at 37 years old. She is now an advocate for breast cancer awareness. For credible breast cancer information, always rely on government bodies, major nonprofit organizations, and reputable hospital sites like Mayo Clinic and Cleveland Clinic to ensure trustworthiness and prevent misinformation. I would like to share some call to action phrases before we end the presentation. Be aware, be proactive, know you're normal, trust your instincts, take charge of your breast health. Early detection saves lives. As we end this presentation, I want to emphasize that breast cancer awareness is critical at every age. Being familiar with your body, recognizing changes early, and seeking medical advice when something feels off can make a meaningful difference. Thank you for allowing me to share this information as part of my practicum project. I hope that today's presentation encourages you to stay informed, be proactive, prioritize your health, and support ongoing breast cancer awareness efforts. Please feel free to leave a comment, share this video, or ask questions. Again, thank you so much for your time and have a great day.